Hey, good. Hi, everyone. Welcome to our APELS session, our patient engagement learning series. Today's presentation will be on developing a patient engagement plan and budget for patient-oriented research projects. So Matt and I from our AbSPORU Patient Engagement Team will be presenting to you a short presentation about how to develop this plan, as well as some resources. And then we also have two student presenters who are doing their own patient-oriented research projects, and they'll be sharing more about their work, and also if there'll be a chance to ask questions and offer any feedback as well on their projects. So in terms of to do research within Canada, we do have three federal research funding agencies who offer funding for research. There's the Canadian Institutes of Health Research, so for health services research funding. There's also the Natural Sciences and Engineering Research Council of Canada, so NSERC, and then the Social Sciences and Humanities Research Council, CHURC. So you may be familiar with all of these or with one of these councils. Now, as for the Canadian Institutes of Health Research, CIHR, it is one of our major funding bodies for health research in Canada. And in 2011, CIHR launched the Strategy for Patient-Oriented Research, also known as SPOR. And then there was SPOR refresh, which was concluded in March of 2024. The SPOR support units were established in 11 provinces and territories across Canada, which includes ours in Alberta, the Alberta SPOR Support Unit. So as you can see from the figure, these are where all the other SPOR support units are. And then most of them do have their own websites, and then in a bit when they are also will be having their own website soon. When we talk about patient in patient-oriented research, what we mean is anyone who has personal lived experience of a health issue, as well as their informal caregivers, including family and friends. Patients can also include members of specific affected communities. So in a lot of research, we also engage community members as patient partners, as they have access to that community, and also are, offer more comfort for other patients when, people from those communities are involved in that research. We abide by the CIHR SPOR patient engagement framework, and so we can share the resource for that. The link is on the slide. We can share that resource to you. The four principles that are included within this framework is inclusiveness and ensuring that the research that you're doing is integrating a diversity of patient perspectives, support, so making sure that there is adequate support, flexibility, and training provided to patient partners. And this can also imply financial compensation for their involvement. Mutual respect is where we're acknowledging that everyone who's involved in the research, that includes researchers, practitioners, and patients, they acknowledge and value each other's expertise and experiential knowledge. And then co-build. We're all coming together to work together from the beginning to identify any problems or gaps, setting priorities for the research, and working together to produce and implement solutions. So now I'm going to hand it over to my colleague, Matt, to carry the rest.
Thanks, Sadia. When doing patient-oriented research and engaging with patient research partners and just hopefully people in general as you move through life, it's really important to recognize sort of the unique lived experiences that everyone and all people bring to the table. Even among groups of people who might be living with the same health condition, for example, chronic kidney disease or type 1 diabetes, there's no single or common lived experience among, that group of people. There may be things that are similar, and there may be barriers that, they all face due to that health condition, for example, but everyone's social, economic, racial, cultural, religious backgrounds, they all intersect with their lived experience of living with, various health conditions. And this creates diverse experiences that can give us all and give patient partners incredibly unique insights into, the research that you may want to conduct. Additionally, when including or you know, um, considering for diversity when working with people in patient-oriented research projects, it's important to note that diversity presents researchers with an opportunity to sort of explore or define research in communities that might have been missed in the past. So I think it's really important that as researchers that we look to embrace diversity and use it as an opportunity to move forward in research practice. Um, in order to, successfully create a safe and inclusive and diverse space, it's really important to utilize, you know, validated frameworks. And the CHR has done that for health researchers. They've created the CHR Research Excellence Framework, which sort of describes an inclusive and comprehensive approach to conducting, you know, excellent health research and patient-oriented research. And you can see that in the sort of 8 key components that they've outlined here, a lot of these practices or key components do surround the idea of diversity and inclusivity. And so it's really important to try and guide your research and plan your research to follow some of these frameworks, as it can, really lead to you sort of supporting your research project in more ways than you could have imagined. We're here presenting the CHR research cycle. This sort of describes the general planning cycle or process when it comes to programs of research or research projects, starting with, for example, priority setting and planning, all the way through in a clockwise motion through to the development of the research proposal, grant submission, scientific reviews, and all the way around the cycle. And what's really important to note here is that effective patient engagement occurs throughout the entirety of the research process and should happen early and often, as early and often as possible or as makes sense for your project. And so what that means is looking to engage with patient partners, patient research partners earlier than you might have anticipated. So instead of waiting to receive funding or waiting to receive ethics to then recruit and onboard and work with your patient research partners, it may be worth bringing them on board earlier when you're doing, the development of your proposal. Working with patient research partners can give you unique perspectives in the planning of your research project and can support your work as far as, basically every step of the cycle here. And so it's really important to do that early and often and open those conversations in order to ensure that patient engagement is sort of at the forefront of your patient-oriented research project. SPOR can support this outside of the support network. So we have Sadia described the SPOR support units, which are the provincial units for the strategy for patient-oriented research, but there are also some chronic disease networks. So if your research project is interested in any of, the following chronic diseases, such as chronic kidney disease, diabetes, chronic pain, and the others listed here. These SPOR entities could support some of your research, as they may have some valuable training resources, capacity building, or networks of researchers that you could utilize to support your project. In addition, there are some other SPOR-funded entities that can support your research. So if you're working in primary care, there's the Primary Care Research Network. If you're working with large data sets or health data sets, administrative data sets, there is the HDRN. If you're working in mental health, especially in youth and adolescents, there's the Access Open Minds entity and the SPOR Evidence Alliance, which supports the collection of patient-oriented research resources. Okay, so I talked a little bit about why it's important to include patient research partners and include them early and often. But some of you might be thinking, especially if you haven't worked in patient-oriented research or done a patient-oriented research project before, might be wondering, well, how do I find patient research partners that want to join my project? So, first I would say is come to us for help if you need it. We have a website listed on the slide, and there's a QR code to bring you there, where we post opportunities for patient research partners to get involved in research projects. We have template, or not templates, but we have posting sort of like guidance that we can provide and input that we can provide when you are describing your patient-oriented research opportunity to potential patient research partners. And additionally, you can look into any communities that you might be a part of that are involved in your program of research or topic of interest. So expanding to look, sort of outside of your immediate research team and looking into the community that you want to work with or study is a pretty big step in looking to identify some research partners. And so to tie this all into budgeting and planning for patient engagement, what this really means is that budgeting for a patient-oriented research project is going to be different from project to project. A big reason for that is due to, like I discussed earlier, the diversity of the people that you might be working with, and also the nature of your own project. And so, when doing something like budgeting for your patient engagement or patient-oriented research project, it's important to try and be holistic and inclusive of all of the people that you might be working with, and understand the diversity of them and the project that you're working on. And so some of the things, for example, that you might have to budget for, depending on who you're working with, could be, aside from compensation and training, like Sadia mentioned, are key components of this work. You may need to support patient partners as far as, traveling, if you're asking them to travel for a research conference. Picking up their conference registration fees is definitely something that should and can be done through these research projects, and other examples of I guess expenses that could be included could be parking if you're having an in-person meeting and you're asking patient research partners to attend, is paying for their parking or their transit or mileage to attend that in-person meeting. Providing support or expensing for caregiving if your patient research partners are caregivers, for example. And in order to, fully work on your project, they need someone to look after the person they're caregiving for. And really, there's just so many different things that you can budget for when doing your patient-oriented research project that, it really does come down to what you're doing and being as specific as you can in planning for that. Our patient engagement team does have a couple of guidelines. So one guideline for patient partner appreciation, our compensation and research, and we also have guidelines for what that looks like at both U of C and U of A, the specific processes that you can take to administer that compensation. And if you need help with budgeting for your patient-oriented research project, you can always reach out to our team in order to, just discuss with us the details of your project and, go over the budget lines that you might have. Patient partner compensations, as I mentioned, we do have compensation guidelines that are on the AbSPORU website, and I'm sure they'll be shared in an email after this session. And there are also some great resources, great, sort of gray literature and manuscripts describing how to work with patient research partners and how to talk with patient research partners about adequate and fair compensation given their specific lived experience. And additionally, we've talked about providing or supporting patient research partners as far as training goes or non-monetary appreciation goes. And so that could be for things like expensing, parking, transit. It can also be for training patient research partners to utilize different softwares or to, join a writing workshop so that they can support the writing on grants or research manuscripts. And so there are a lot of different ways that you can show appreciation for your patient research partners that are not, honorariums or hourly sort of wages or compensation. Very briefly before we end here, I did also want to describe some of the team training offerings that the capacity development team at the AbSPORU support unit have. And so that includes things like workshops and e-learning modules about patient engagement, patient-oriented research. There's also certificate courses. So there's a certificate course for patient engagement in patient-oriented research that our team worked on. And there's also a certificate course on implementation sciences in patient-oriented research if you're doing a project that's looking to implement new programs or innovations into healthcare. And there's also the graduate studentship, which I believe the deadline's passed this past year. It's usually in November, December. But the graduate studentship is open for any trainee in Alberta who's doing a patient-oriented research project to apply to. And so there's some funding there for graduate students looking to complete their patient-oriented research projects. And lastly, this our final slide sort of just covers sort of a summary of what our patient engagement team provides. So as I mentioned before, support for developing a patient engagement plan and also the budget. And we can support you with review and feedback on, the patient engagement aspects of your grant applications or on your research manuscripts, or support you in recruiting patient research partners. A lot of different services that we can support you with. And so if any of these sound interesting to you, or like you might be interested, or you're wondering if we have other supports or services that we could provide, feel free to reach out to us and we can talk more about that and how it relates to your specific project.
I want to also touch base on some of our own, like some of our resources as well as some of our initiatives that we've done in our team. So one thing that some people might want to consider is, thinking about how are you going to share the knowledge that you have gained from your research. One way that we have worked with researchers is through working with their patient partners in developing digital stories that they can then use for knowledge translation purposes, or for education and building awareness of, say, their lived condition or working in health research. And so I put a little bit of information up there about our digital storytelling workshops if you're interested to learn more about what those look like. We also have some initiatives such as our Journal Club, which is our monthly initiative where we invite everyone who's able to come and discuss an article. So we usually invite the first author as well as any co-authors of the publication to join and give a presentation about their paper, and then we have a discussion afterwards with the authors about their paper and their project. And so it's a great learning experience for anyone who wants to learn more about patient-oriented research, but also connect directly with the authors who wrote those papers. We also have our podcast as well. So those are freely available for anyone to listen to about specific projects that are ongoing within the province and also elsewhere. And then our APELS series, of course, our patient engagement learning series that we've started about, different topics that we cover every month. We also wanted to talk a little bit about our Accelerator Award. So this is something that we offer to early researchers as well as students, clinician researchers, a one-time award. So if this is something you're interested in, this helps to cover that early aspects of engaging, patient partners at, say, the priority setting stages or in developing your project. And we can award up to $500 per project. And so if this is something that you're interested in, feel free to reach out. We also have courses available. So we have we have a graduate course in public and patient engagement and health research. And this helps, to really understand the theoretical overview of patient-oriented research and also have the opportunity to learn directly from experts, including patient research partners and academics and clinician researchers. And we also have our PACER course, and this is directly for those who are interested in getting involved in, peer-to-peer qualitative research, so patients and community-led research. And so what happens is that different research teams or, academics, they sponsor a PACER team to co-conduct their research project, and they're able to, to undertake this qualitative project and are at the end do come out with a report which can lead to a publication and other opportunities to share that work. We also do have our annual Northwest SPOR Collaborative Forum. So this upcoming year, it's going to be from May 12 to 14 in Calgary. It's usually held every spring. And the call for abstracts actually just came out for the Northwest SPOR. Definitely encourage you to, submit an abstract for either a poster or a panel or a lightning talk or whatever, or perhaps even a workshop if that's something that you're considering to, share the work that you've been doing, as well as learn from others who are doing similar work or different and different approaches to, working with patient partners in their research. We also do have our Alberns for Health Research Instagram. So this is our, public facing Instagram, which, is a way for us to connect directly with other patients, but also community members and researchers. And it's a great way to, deliver information about health research in a much more lay fashion and easy way to understand rather than more academic jargon. And so we encourage you to, have a look at our Instagram. If you have ideas about what you'd like posted. So if you have a project and you'd like to, help us post it through our AbSPORU Instagram, feel free to reach out to us. We're always happy to, work with you on sharing results about your work or sharing a little bit of information about your work in a way that's more easily accessible to the public. And in conclusion, patient engagement is a powerful way to improve research outcomes, make these research outputs more meaningful to patients and to strengthen health systems. We're using these strategies so that the benefits of patient-oriented research can be enjoyed by all Albertans. And we wanted to let you know that you're not alone in your patient-oriented research journey. You're always welcome to reach out to our team and to also, reach out for collaboration opportunities as well if you're interested in, working together on a project or availing our services. Want to acknowledge our funding bodies. And at this point, I'm happy to take a few questions before we dive into our student presentations. I want to make sure we have enough time for them. So if anyone has any questions specifically for Matt and I, please feel free to leave it in the chat right now or to unmute yourself.
Hello, can you hear me?
Yes, we can.
Hi. I wasn't able to get in on Zoom. When I entered the passcode, it wouldn't let me into the room, but it allowed me into the room by phone. My name is Joan. I have tried to reach out to SPOR, but I haven't been successful at setting up a meeting or hearing a response related to some of my questions. And so I'd like to know what the best contact information is to reach out again, because I'm not sure what happened with the contact I tried to talk to.
If it's directly with our patient engagement team or patient engagement support, then we can provide you with our email that, but the general SPOR email is also there too if you want to reach out to the other teams. Are you able to see the chat?
No, no, I cannot.
Okay, so what Ingrid's planning to do is send out our slides anyways afterwards with our contact info, so we can include it there, and then you can reach out directly to that email that's from our APELS.
Perfect, thank you.
Any other questions for Matt or I? All right, so I'm really excited to present to you the next two student presenters who are doing patient-oriented research projects within their at the University of Calgary, both of them. Our first presenter is Netanya Winterburn, who is a master's student in neurosciences at the Hotchkiss Brain Institute in the Cumming School of Medicine at the University of Calgary. Her project is on patient empowerment, bridging community, people with lived experience of epilepsy and basic science through patient-oriented research strategies. So I'm going to pass it over to Netanya and to share her screen, and then she can get started.
Thank you, Sadia. Yeah, 1 second. Please let me know if you see my screen okay. Perfect. So I'll just hide this from you. So hi everybody, my name is Netanya Winterburn, and I am currently a Master's of Neurosciences student at the University of Calgary. Today, I will be discussing my work with iNeuron in my project, as Sadia kindly mentioned, bridging community, people with lived experience of epilepsy, and basic science through a focus on patient-oriented research. So as many of you know, people with lived experience are individuals who have experience living with a certain condition. This doesn't necessarily have to be the individual with the condition itself, but can also be the family members, caregivers, friends, or others who have experience with that condition entails. When engaging people with lived experience in research, AbSPORU defines as equal partnerships where people with lived experience provide that critical stakeholder feedback, advising all different stages of research. This can be objectives, study procedures, outcomes, and then this feedback guides research priorities to make them more impactful and applicable for addressing community needs and concerns. So patient engagement can be seen in many forms throughout research, such as through getting involved in providing feedback. It can be as simple as, well, I wouldn't say simple, but participating in studies, or even helping lead research activities by highlighting impact the study may have on the community's needs and concerns. So to learn about patient engagement, as part of my master's degree, I have joined Team iNeuron, which is a Canadian-led research project funded for $24 million by New Frontiers in Research Fund. More specifically, I am a member of Team ABLE. So ABLE is the advisory board for lived experience of stroke, dementia, and epilepsy. Our specific role in patient engagement were Dr. Jacob Slavan, my supervisor, and one of the PIs in ABLE, and I are responsible for the epilepsy representation of this group. This is where the real challenge comes because we have to incorporate patient engagement into the field of basic science as part of my project. However, to give a quick overview of what we do within ABLE that I am then learning to translate into my project is we translate research into accessible language using feedback from the advisory panel of people with lived experience. We develop guidebooks, infographics, and glossaries to translate the project's scientific knowledge into common terminology to ensure that it can reach a broader audience and maintain transparency in the research process. This is supplemented with glossaries made by the team to ensure that people without a scientific background are empowered with knowledge rather than limited by it. Through our workshops between researchers, trainees, and ABLE members, we aim to create a win-win relationship because researchers and trainees can learn from people with lived experience about what's really important to them, about their experience with that condition, and then people with lived experience will feel empowered learning from researchers. So where does my project specifically come in? Firstly, I just want to mention that epilepsy is a disorder that occurs due to fluctuations in electrical functioning in the brain that then causes recurrent seizures. For my project, I am currently conducting a systematic review of available literature on patient engagement strategies in basic science, and more specifically seeing what is available in the field of epilepsy. So far, we know that there's quite little patient engagement strategies applied in epilepsy research. iNeuron has been a framework for me to learn and understand firsthand experiences that individuals with lived experiences have faced when involved in research. So using these skills learned from knowledge translation and applying it to my master's, I am basing my thesis on developing recommendations of patient-oriented research strategies that can then be applied to epilepsy research. My end goal is to collaborate on developing on an advisory board people with lived experience of epilepsy and utilizing our findings on engagement strategies while connecting these members to institutions that are conducting epilepsy research. For my project, I've learned how to relay scientific information in this more accessible manner when developing these recommendations of patient-oriented research strategies. However, in practice, we hope to continue recruiting volunteers, same within iNeuron, to continue building connections with our ABLE members and reaching out to other support networks to join together these people with lived experience of epilepsy to establish an advisory board. One challenge I will mention later is that our recruitment's very narrowed currently to the clinic, where we recruit individuals with epilepsy or experience of epilepsy from the clinic, which actually poses some challenges. Once we've done this, we hope to test our recommendations of patient engagement strategies when connecting the advisory board with those researchers. People with lived experience will provide critical feedback through surveys on how they feel their level of engagement is contributing, areas of improvement, and the same will be done with researchers. Using this knowledge, we will adapt our methodologies to ensure recommendations will be well established before we recommend them to researchers. However, when considering recruitment, everyone's time is exceptionally valuable. Therefore, for now, our approach will be voluntary and meetings will be virtual to ensure it is accessible to most individuals. We would ensure to create workshops so that individuals are fully trained on research principles or basics, if you will, and the different means of engagement, and so that they feel supported so that when they are engaging, they feel that it is meaningful. I hope to be able to establish means where we can provide compensation for their role and support. However, I believe within the scope of the project as an ABLE, we may need to contribute voluntarily for the time being. Though, alongside the way we do with ABLE, when hosting conferences, the accommodations and travel for advisory members to attend are provided through the ABLE Research Fund, as will be disclosed to ethics for approval, so not to strain any individual traveling voluntarily to support the project. So some of the challenges we faced, even in ABLE, which we anticipate we will face for my project, is the recruitment and identification of people with lived experience of epilepsy. Epilepsy, like many conditions, is highly stigmatized. And the level of stigma and discussion has posed a challenge among different cultures when engaging with individuals, especially since we consider diversity, equity, and inclusion as a priority in research. As mentioned before, most of our recruitment or even coming into connection with people with lived experience of epilepsy is in our hospital clinics. And this is after the physicians already mentioned the project or the existence of ABLE to them. Most often than not, we do not get much recruitment from our more diverse population, and we are still trying to explore why that is and how we can maybe span out to those communities and encourage engagement so we have a bigger representation in our advisory board and we can relate to the community better with their needs and concerns. Secondly, there's no real consensus on how is best to engage patient partnership in research that's applicable to every field of research, especially in epilepsy. This is challenging as we can base our recommendations on different fields of study, different conditions, but this may not apply to individuals with epilepsy. Thirdly, when we do apply our recommendations down the line, we need to identify a standardized method of assessment to see if our engagement strategies are making a difference, if people with lived experience feel accounted for and heard in the research process. Though there are survey assessments that engage experts on people with lived experience on managing their own healthcare or how they view patient engagement research, developing a formal standardized method or utilizing methods that can be applicable to epilepsy may end up posing a potential challenge. Lastly, one challenge that we are still unsure how to tackle is if researchers are actually implementing this feedback from people with lived experience into their projects and how they're going about doing so. At our recent conference with ABLE, we conducted a workshop between researchers and trainees. In this workshop, I've learned that engagement of priorities of people with lived experience has been difficult for researchers to understand and further more difficult to implement into their research. Though researchers may be looking for methods such as cures or ways to alleviate seizures for individuals with epilepsy, it was importantly highlighted by one guest member with epilepsy that they would rather have a seizure every single day and that it was the least of their concern. They highlighted that their most prominent concern was their desire to end their life, as epilepsy has had a very difficult impact on their mental health, familial relationships, and means of accommodating their basic needs, such as getting a job to buy food, primarily around the stigma. These are aspects of feedback that we normally don't know when we're studying epilepsy. Therefore, it's absolutely crucial for researchers to also hear this feedback and then dedicating to researching ways to alleviate the lesser known symptoms of epilepsy, such as the deterioration of mental health, rather than focus solely on how to stop seizures. So my presentation's a little quick, but I just want to quickly show my acknowledgement for iNeuron and the PIs who have led our team and supported my project, and a large thank you to AbSPORU for providing me the platform to learn from the courses I've been taking to guide my project and to showcase my work on. So thank you for attending, and this is just a few of the recommended literature I have. And this is an informatory video that I think is very meaningful to show how stigma around epilepsy can vary across different cultures. And this one is primarily for, in Kenya, we see how stigma of epilepsy is seen as epilepsy is a demonic attack of a means. So it's highly stigmatized. People think you're sick and that you need to pray it away. So it's largely different than what we study here in Canada. So I encourage you all to please watch it. It's not too long, and thank you again.
Thanks so much, Netanya. Thanks you for your presentation, for giving, and also for the questions and challenges you've been facing in your work. I'm wondering if anyone has any questions for Netanya or any suggestions or recommendations for her project.
First, I love the way that you and your team is looking to prioritize making communications and the language of epilepsy and health research in epilepsy more accessible to people in the space. I think that that's an understated but important aspect of a lot of health research is just being able to communicate effectively. And so I think that that is like very important, and I'm glad to hear that that's happening. One of the questions I had for you was, sort of along the lines of that communication, is how you and your team are sort of looking to communicate these very important patient-oriented research principles to the basic sciences researchers that are doing this epilepsy research, because it's one thing for to expand understanding of the research and disease for patient partners, but also for the researchers when you're looking to sort of change the attitudes of the field or the work that's happening.
Yeah, that's a great question. Thank you for asking. So through my work with iNeuron, or ABLE more specifically, I learned that when we put researchers and people with lived experience in a room, it's a lot different than what we have in our department when we're just talking to researchers about it. So our goal with the project is utilizing some of these connections that we have for people with lived experience of epilepsy, and some of the connections we already have established with epilepsy researchers within the entire team of iNeuron, and then trying to create this advisory board and recruit them on so that we can cross-translate this information. Now, there is some surveys in place, such as the Delphi survey, which has expert panelists, and then you ask them questions about how they view a topic of any means. So we were thinking that down the line, when we do take the step in engaging researchers and connecting them to our people of lived experience, we would first try to approach them with a standardized survey of that means to see where they are in patient engagement. What do they do in their research to take that feedback and reflect it back? What do they want to see? What do they want to learn from people with lived experience? By doing that, we hope that then we can survey the people with lived experience and see where the gaps are and work towards closing those gaps. I hope that answers your question.
Yeah, it did. Thank you.
Thank you.
Any other questions for Netanya? All right, so I think for sake of time, we'll move forward to Valerie's presentation next. So Valerie Cates is a PhD student in medical sciences at the McCaig Institute, Cumming School of Medicine, University of Calgary. Her project is on developing and assessing a patient decision aid for adult spinal deformity surgery using visual art to draw a better understanding. So I'll let Valerie go ahead and present. And Valerie, we can see your presenter notes.
Yes, I'm just switching that around. I'm glad we did that beforehand. So, okay, perfect. Thank you so much for having me here today. Yeah, my name's Valerie, and I'm a graduate student doing my PhD at the University of Calgary. So I'm going to be presenting a bit about my work and sort of discussing my different approaches to patient engagement as I go through here. So, a bit of background about what I look at. So I study adult spinal deformities, which are complex, debilitating, and painful conditions that are characterized by malalignments of the spine with increasing age. Surgery has been shown to improve both subjective and objective patient-reported outcomes, but it's not without pretty big risks. So managing patients' expectations before they go in for surgery is really, really important for their satisfaction when they come out of surgery. One method of managing expectations is through things like patient decision aids. So these are tools that are designed for patients to support shared decision making. So they can increase patients' clarity of their healthcare values and goals, increase their treatment knowledge, and decrease rates of decisional conflict. There's not necessarily one way to go about developing a decision aid, but generally speaking, the APELS criteria is one of the more commonly cited frameworks. So it's a large 64-point checklist, but within that checklist, there are some limitations, including the considerations of visual aids, which account for about 6% of that checklist. So we are interested in supplementing with additional tools like the Patient Educational Material Assessment tool, which has about 25% of this checklist mention visual aids. And it basically breaks things down into how easy is the content to make sense of and how easy it is to act on, depending on the presentation medium. So if it's a paper or an audiovisual format. When I talk about visuals, I'm really talking about bits of information that are presented in an approachable way. They've been shown in the literature to improve the patient experience, especially when we're talking about patients with limited health literacy or elderly patients. But just like any type of communication output, it's always important to consider who is the audience, and if you can, integrate them in that design process and development process early on. So that brings me kind of to my research aims here. So I'm essentially looking and reviewing the landscape in a scoping review. I'm developing a patient decision aid for adult spinal deformity. And ultimately, we want to compare how visuals contribute to using that decision aid. Our ultimate goal here is designing something that is reflective of the decisional needs that patients and caregivers experience and empower them to make informed treatment decisions about spinal surgery. So I'm going to focus primarily on these two aims for the remainder of the presentation and talk a little bit about some knowledge mobilization ideas coming up. So before we did anything, we really wanted to see what was available out there. So really identify, are there any spine decision aids for this condition? What ones are available and how do they use visuals or not? So just like any scoping review, we started by searching online, screening available options out there, assessing if they met our eligibility, and then we did some interdisciplinary evaluation. And this was where we started integrating patient partners a lot more into our research. So we had a patient partner who'd previously undergone this type of fusion surgery. We had a spine surgeon who does this type of surgery, and then myself who's learning about it and has an appreciation for art and design. So I was connected with our patient partner through my supervisor, who's a spinal surgeon. And in addition to providing some really interesting perspectives on the patient experience side, she also previously worked as a nurse educator before retiring. So she had a really interesting insight into the education component and sharing knowledge and communicating medical conditions. So we were able to find 9 decision aids online. And so we sent these around via email. We all independently evaluated them. And then we came together for coffee just to discuss what our takeaways were, what our impressions were. So based on our sort of 3 reviewer scores in terms of PMAT, we found that most of the decision aids available were pretty accessible. They made sense. They were easy to understand, but they didn't really facilitate a super strong action. So things like providing checklists or outlining what my next steps are, they didn't really capture that as well as they could. We also spent a fair bit of time discussing the visual side. So Predominantly, most of the decision aids tended to use tables and scales as their primary visual aid, but think about what a table is. It still is a text-based format of presenting information. So that was interesting to see. And then the decision aids that we liked most tended to use a variety of visual modalities and scored highest on PMAT. So really interesting conversations in that, really different perspectives, especially having a patient and a spinal surgeon on the team and hearing where we found commonalities and where we had differences. But we recently actually just completed a manuscript and are in the submission process. And so some of our, as co-authors, some of our takeaways is that there weren't really many tools out there for this condition. Most decision aids are text heavy, and we advise that patients would really be involved in the development of tools like this. So that brings me to my next aim here, which is developing one. So this is kind of where we're currently at. It's a very iterative process where I design a prototype, I put it in front of people, get their feedback, and I go back to the drawing board and do it over again. So our first prototype, we had experts evaluate this mainly to assess if it was medically accurate. Took that feedback, made a second prototype that was assessed by post-operative patients and caregivers to understand and make sure that this was decisionally accurate. So were these the choices that you had when you were going through this process? Right now, we're kind of in the midst of forming a steering committee. So inviting those interested past participants back and starting to integrate them more, allowing us to revise and make sure everything is good to go before we design a third prototype that will be evaluated by preoperative patients and caregivers, really to assess that user experience side. So all of this is done through interviews. So they range from 30 minutes to 3 hours, depending on who the person is. We can do them, we've been doing them in person where we pay for participants parking. We give them a tour of the space. We have a lot of cool things happening at Foothills. And alternatively, we can do it online as well, given that some people are coming from out of town. So lots of flexibility in that. But essentially, all this consists of is conversations and trying to understand what's working and what's not working in the decision aid prototypes. What's been interesting about this is because it's long conversations, I've also been learning a lot about what's working and not working in our current surgical practices. So adult spinal deformity communication, that center thing, is one of 3 major themes that I'm coming across in my interviews with postoperative patients and caregivers. We sort of see these 3 sub-themes surrounding it and then sub-themes within. But one thing that I think is really standing out is just the desire that patients and caregivers have to connect with people who are going through this. So many have expressed that when they were deciding on surgery or watching their loved one go through this, they really felt alone in that decision process. So aside from a surgeon who's probably short on time, or caregivers who maybe don't understand what it's like living with this condition, many patients really just wanted to talk to someone who had gone through this and learn sort of what to expect and what will they be signing up for with that. So I have had some patients straight up say that, you know, I would love to provide my name and number for your decision aid so any future patients could contact me. I'm not totally sure that ethics is going to be okay with that, but I do think it provides a really interesting point for knowledge mobilization in the formation of an advisory group consisting of patient partners who have expressed interest in continued involvement. So not totally sure what this is looking like. I think we're still quite in the early phases of it, but it could be, you know, we come together for an annual in-person meeting. It could be that we meet more frequently online because people are from out of the city limits. But essentially, we could form a group here where we could all work to not only support other patients who are going through this and connect them, but design different tools that would have helped them in their decision-making process. So some ideas that have come up in the interviews have been like going on Facebook to find a group of patients with this condition to connect with them. So there's not really anything like that I've seen online. So it might be that we form this advisory group and we can make a Facebook group where we're all administrators and manage that. Another knowledge mobilization product would be to create a YouTube video. YouTube was a commonly they commonly came up as a way that patients tried to learn about the complexities of spine fusion surgery and adult spinal deformities. Ultimately, we could combine that to make sort of an online platform that provides resources like the decision aid we're developing, links to Facebook groups, YouTube videos, and connection with other patients. So still really in the early days of this, but working and interviewing patients and caregivers and talking with them and just having conversations has really opened up the potential for where this project could go. And I'm super grateful for the ideas and feedback that we've gotten so far. So in interest of time, doing this work has really helped me identify where communication gaps are, both in the tools that we're designing, but also in the surgical practice itself. It's allowed me to find new ways of sharing information, but ultimately find out what matters most to people in this decision-making process. So hoping to leverage all that to form an advisory group and co-design some additional products that can further support patients and caregivers. So I'll leave it there. That's kind of a summary of my work, and I can open the floor if anyone has any questions.
Thanks so much, Valerie, for your presentation. I'm wondering from where you are at right now, whether you were surprised by any of the findings that you've come across so far with talking with the patients, as well as your patient partner and also the clinical advisor that you have, or has it been some, like, what you've kind of found in the literature?
Yeah, that's a great question. So, when I go into these interviews, my primary goal is just to understand, what's working and what's not working. What do people like in the decision aid, and what maybe could we be doing better? But because, we're doing those long interviews, so, it's natural that other things come up. You ask questions and it provokes a response and different ideas. So, I presented kind of on the communication theme, but there's a whole bunch of other themes that are coming up, like the reality of coming out, sort of the mental and physical struggles that associate with it, how resilient this population of patients are. There's so many patients who are just, despite all they've gone through, some of them have gone through upwards of like 15 revision surgeries, and they are still going, they are still looking on the bright side and wanting to contribute, different treatment options that are available, and sort of this feeling of not having other choices. That's very much in line with the literature for this patient population, is because back pain can be so debilitating. They often feel that like surgery is the only thing that's going to fix them. And so that's definitely coming through in a lot of our interviews as well. In terms of working with the patient partner in the scoping review, it's been really interesting having someone so involved on the team, and just how we've all grown working together. So when we started this work, she was very much just like, yeah, I'll help out, but like, I don't want credit, I don't want this, I don't want that. And now we're at the point where like she's excited to read the manuscripts and wants to be a co-author on this. I think it's been interesting in that one, because having the spinal surgeon and myself who, we study this stuff on a daily basis, and having a patient partner, certain things on the PMAT checklist of like uses lay language is one of the items on that checklist. To the surgeon and we found some of the material very straightforward and clear, but to our patient partner, she was like, even though she had that background as a nurse, she's like, I don't understand what that means at all. So I think whenever you're involving, people in your work, you're going to find new ways of communicating and find new ideas in that. So there's been a lot of surprises in this research, but like necessary and valuable things that I think really can direct the future of this research and how we do it in our current Calgary practice. So hope that answers that.
Yeah, it does. Thanks so much, Valerie. I'm going to turn over to Ingrid for any closing remarks for our Apple session.
So, thank you everyone for joining. Does anybody have any overall general questions? Anything they thought of that they want to ask Matt or Sadia? Okay, so thank you for joining. We will, and thank you to the presenters. We will share the recording, we'll share the slides, and we'll share the resources that were mentioned in this presentation. Yeah, and we'll also share when the next APELS session will be in the topic. So thank you everybody for joining. We'll also share the link to the AbSPORU SPOR Northwest conference so that you can submit your abstracts. Thank you very much.